In a world filled with public health issues like H1N1, HIV, gonorrhea, poverty, pollution, plague, we proudly present to you
the SDCC SHEPT program, San Diego Community Colleges, support for higher education among pregnant and parenting teens. Our goal is to decrease the dropout rate of 18 to 19-year-old pregnant and parenting teens in the San Diego Community Colleges. Our purpose is to create competent and self-dependent members of society despite early pregnancies.
Group 9's objectives is to develop a web-based guide and social media tools for the young pre-postpartum mothers and fathers between the ages of 18 to 19 to use as a guide to continue working towards their goal of attaining a higher education. We have 3 objectives to get this done. 1. By the end of the first year of the website program implementation, 50% of website members will be actively pursuing their higher education degree. 2. To reduce the annual dropout rates among pregnant and parenting teens by 20% during the 2015-2016 school year. And by the end of the 2015-2016 school year, for community college participating will have a decrease in the overall dropout rates of the targeted population.
Are conceptual models adapted from the theory of planned behavior. In the model, it explains that an individual's behavior affects their intent to complete the degree or not, which impacts the outcome of the decreasing dropout rates. There are 3 factors that contribute to the intent of completing the degree. The factors are perceived control over higher education, peer norms, and attitude towards completing the degree. The intent of completing the degree then influences maternal and child health and actually achieving that degree.
Measuring the outcomes. At the beginning of our program, a baseline survey will be given to the participants through their email. When individuals sign up for the program, they will receive a survey that measures their current progress in college, goals, and considers personal factors like term and pregnancy and use of government programs. Multiple quantitative measurements will be taken in the form of surveys that will be given at the end of each semester to measure progress and related factors. With the submission of each survey, the individuals receive a $10 gift card. This equates to a baseline survey, 1 survey each semester, and a closing survey at the end of the 2-year program period. Our evaluation design is a randomized experimental design, and we chose an experimental design due to the fact that we needed a control group and an experimental group with the same characteristics in the population we were interested in. We will be using 4 community colleges in the San Diego County for the control and 4 community colleges for the experimental group. The experimental group will receive our intervention, while the control group will receive another website to help control for external validity issues. The only factor we want to see change is the rate of dropout between both groups involved in our intervention.
In conclusion, we want the pregnant and parenting teens to have the chance that everyone else does, despite having a child or being pregnant. They need to get that degree, and we're here to help them.